with the world. So keep your questions till the end. We'll make sure we get them all answered. But because we have a lot of people on, we want to make sure that we hold off till the end. Well, look, this is going to be an exciting webinar for you if you're joining. If your doctor told you that there is no hope for your hearing problem, for your inner ear issues, whether it's dizziness, whether it's tinnitus, whether it's hearing loss, well, that's what makes this exciting to me. And that's why I'm here today, because this technology you're going to hear about in the webinar, well, it changed my hearing. It changed my life. And the key here is, well, you're going to hear about technology that people from all over the world have been flying to Germany for. And for the first time, you're able to get this technology in the US. Well, I'm really happy to bring Amen Kaiser, who is all the way from Germany. So we'll welcome the developer of this technology and the founder of this technology from Germany. So welcome, Amen, and thank you so much for being here. And Dr. John Lawrence, you're going to meet from Sarasota, Florida. So this webinar is, you're going to hear just how exciting this technology is. And again, why I'm really excited about it, because it made a difference in my life. But truthfully, hang in there till the end, because I want you all to have an opportunity to get your questions answered and an opportunity to discover this technology that you don't have to fly to Germany for right now. But with that said, let me bring and introduce you to these gentlemen, Dr. John Lawrence and Amen Kaiser.
Hi, thank you for that introduction, Dr. Pompa. So we're going to be presenting some exciting technologies and some exciting data here on how you can actually repair the inner ear. And I know that if your doctor told you that it's not possible, a lot of people have never had the opportunity to learn about this, because it's such a little known technology. And like so many natural strategies, there's a patent issue where the money to give this exposure on TV just isn't there. So this is something that historically only very wealthy and politicians have learned about. I know Dr. Kaiser in southern Germany and Baden-Baden has treated some very affluent people, and also some not so affluent people that have traveled there for this treatment. So we're going to be getting into the nitty-gritty of how this works. Dr. Kaiser and I are going to be presenting some slides here, so we'll go ahead and get started. Okay. So, Dr. Kaiser, welcome. Why don't you go ahead and explain how you got involved with this technology?
Yes, of course. First of all, thanks a lot for the invitation to this webinar. It's very exciting for me to support you in getting more public in the US, as it's really necessary. We have so many patients coming from the US that need support, that need to get treated. I myself, I founded the LUMOMED therapy 20 years ago. I'm the son of the very famous pioneer in treatment of inner ears, Dr. Weldon, who was the first one who started to treat inner ears with lasers. And I myself, I'm treating inner ear diseases like tinnitus, vertigo, dizziness, hyperacusis, dysacusis since nearly 20 years in Baden-Baden. In the meantime, we successfully treated thousands of patients, and I'm very, very happy to have this connection to you, Dr. Lawrence, in Sarasota, Florida. So finally, all those patients who had to fly for several hours from America to Germany now have the possibility to get the treatment in a very high and perfect quality of my colleague, Dr. John Lawrence in Sarasota, Florida.
Well, that's kind of how we met, wasn't it? So I had a patient come to me that had something called menières, where she had tinnitus, hearing loss, and vertigo. And we were able to do a lot of work for her vertigo, but not so much with the tinnitus and the hearing loss. So I was always interested in how I could bring more therapeutics to actually move the needle with these two conditions. And so she flew to you and reached out to me and said, my tinnitus is gone, my hearing is much improved, and you need to learn this technique that this doctor in Germany is doing. And, you know, I wanted to go out there and learn about it, but it was one of those things where it was like on my to-do list until I was in Germany doing something else. And I posted on Facebook and she said, you're literally like just 20 minutes away from Ahmed Kaiser. You've got to go over there to his clinic. So I went to you, and that's where this all started. And here we are.
Yeah, absolutely exciting. And I was very happy to meet you. And I also was very excited that you're so open for this technology. And finally, we installed it. Finally, we started this. Now I think it's quite established now. In the meantime, you also treated several, I think, hundreds of patients in the meantime in the last years. So I think the success is speaking for itself. Yeah.
Yes. Well, great. Well, with that said, let's get into the some of the subject here. So this is an image of someone actually receiving LUMOMED. We use special lasers. They're extremely specialized to actually safely treat the inner ear. What people need to know is that the therapy doesn't hurt. You feel like maybe just some sunlight shining on the side of your head. And these laser beams are very special because they won't heat up the inner ear. And we'll get into a little bit of some of the technology of how that works. But this was me in 2017 when I was featured on ABC News. And so this was featured on a major news network. Dr. Kaiser, if you'd like to go ahead and maybe talk a little bit about the structure of the inner ear.
Yes, of course. What you can see on this slide is, of course, you see the external ear. That's what everybody knows. I go from left to the right side. When you see the slide on the left side, you see the ear canal with the eardrum. This is what we call the external ear. Then you see the ear bones. Those are three very, very small bones which transport the vibrations of sounds to the inner ear. The inner ear is now the part on the right side, what you see there. And the inner ear has two main functions. The one is the equilibrium. This is the part for the stabilization of your system, so the orientation in the room. This gives you the impression of how in what position your head is. And the second main part of the inner ear is, of course, the hearing organ. It's the so-called cochlea.
Excellent.
What you can see on this slide is a cut through the inner ear, through the part of the cochlea where we hear. What you see on the left side is the inner ear is a really very fragile and very sensitive and very, very small organ even. On the right side, you can see the hearing cells. Those are the parts of the hearing which are reasonable for the transport, or which are like you can compare them like a light switch. If they are removed, you get the impression of a sound on in your brain. So this is for what the hearing cells are. What you also see there are the so-called supporting cells. Those cells are supporting the hearing cells, and altogether we can increase the quality of those cellular structure. So if we got a damage there, if your ears had been overforced, overstrengthened through extreme noise, for example, but also because of stress situations or medications or toxic situations, those cells are in a stress situation. And what we can do, with the LUMOMED laser treatment, we can extremely increase the quality of those cells. So if they are damaged, we help them getting healthy again. So I go to the next slide. What you can see here is again a cut through the cochlea, so the hearing, the part which is reasonable for the hearing. And most of all you inner ear patients out there already have done a hearing test. And to understand what the hearing test shows you is, I think these pictures are quite simple to understand. You see on the left side, on the top, on the left side, you see a healthy cochlea and a quite healthy hearing test. So if the line on the hearing test is very up, that's a healthy organ. If you compare this with the right side down, you see that there is nearly no cellular structure. On the right side up, you see that the half of the hearing capacity is okay, but in the high frequencies, you already have a very big damage.
Yeah, you know, it's always interesting to me because the higher frequency hair cells are on the outside. So when the sound comes into the inner ear, that's the first structure that really takes that initial blow from sound. And that's also where we start to lose our hearing.
Yeah.
So, you know, there's a lot of causes for hearing loss. So, you know, obviously there's some genetic causes. People can get viral infections, you know, head trauma, impacted earwax can affect your hearing. People can get a ruptured eardrum with like diving injuries and so forth. Foreign objects, allergies, different fluids. So loud noise and exposure to loud noise in your environment, oftentimes it's your work environment. Sometimes it's recreational concerts and so forth. And then the aging process, actually having birthdays. You know, these are all things that can have a negative impact to the inner ear. And over your lifetime, it's normal for these things to actually age and become degenerative. But, you know, what we're talking about today is a way that you can give back to those structures. You can actually get some rejuvenation to these areas that really take such a traumatic hit, especially in today's age. I mean, everybody's wearing the earbuds. You know, we have sirens that are louder. There's just such a more impact to the inner ear than there was in any time. We have not evolved to be able to handle the type of insult that the inner ear gets in today's world.
Right.
And, you know, one really important thing to consider is they've done studies where people with, say, just mild hearing loss, where you actually had a higher incidence of memory loss. And with more moderate to severe, you have 3 and 5 times more likely that you'll have dementia. So this isn't just a conversation about your inner ear and hearing and communication. I mean, obviously, communicating with your friends and family is super important, right? And when you're not hearing, you're missing things and you're asking, what did you say? Obviously, that can create some friction. It can create some feelings of isolation. There's a lot of negative emotions that might be involved with that, but the impact that it has on the degenerative aspect of your brain is just as important of a conversation that you need to really take a lot of attention to here. You know, hearing aids, this is the typical answer for people that lose their hearing. And so what a lot of people don't realize is that what you're doing, so sound stress is the primary insult that's causing some degenerative aspects to these hair structures that that Ahmed Kaiser so eloquently described earlier. And these are very fragile. So the sound stress to these hair cells is what you really want to avoid. So if you can imagine, if you're going to put an amplifying device into your ear, you're going to be creating more sound stress to those hair cells. So it's just logical to realize that you're going to be accelerating this damage and this hearing loss. So it's not the best answer. So when a lot of these audiologists prescribe these hearing aids, they say put them on in the morning, take them off before bed. This is not how we recommend our patients to do it. And we're not going to get into a lot of the nitty-gritty, but we have some specific models that we use with our patients to make sure that you get the best results with this LUMOMED treatment, which we're going to get into a little bit more detail with. And this is a study just talking about how hearing aids can over-amplify and cause damage into the ears. another study on experts with wearing ear protection. So we're big proponents of wearing hearing protection. And, you know, if you become a patient of ours, we're going to give you a lot more of this information to be able to really take advantage of how you can protect your ears, because it's very important to protecting those hair cells from damage. So, Dr. Kaiser, would you please get into some of the physics behind how laser therapy works? Because this is really at the core of the LUMOMED treatment. So what is laser and how does it affect that inner ear?
Well, you know, in the past, we had to increase, the main question always was how to reach the inner ear, because the laser technology also was a development in the last 20, 30 years. And the first lasers, they were quite big machines with a very, very low power. But in the meantime, we have got the possibility to bring a very high power level into the deep tissue until we reach the inner ear. And with the laser light, we have a biostimulation of the cellular structure that is damaged. So this means we have a direct and very fast effect on the inner ear cells, because as we reach with our high power lasers the inner ear, we have an immediate effect on the cellular energy production. In the moment when the laser light reaches the inner ear cells, we have an increasement of the so-called ATP. You can compare it with a fuel that we need in every cellular structure in our body. And we need this fuel for
fuel, like an energy source.
Yeah, that's my English. Like a fuel, okay, not a food, a fuel. That we need for every cellular work. So we need this fuel for hearing work, but also for regeneration. Mm-hmm. So, of course, if you use the hearing aids or if you have problems with tinnitus, you should avoid every noise around. So you should avoid every unnecessary work, especially during the time and after the time of the LUMOMED treatment. We increase the power of the cellular structure, and this should be used for regeneration and not for unnecessary hearing work.
Mm.
With the laser light, we have several effects on the tissue. We have a regeneration. We have improvement of the circulation of the blood. We have reducement of pain and inflammation. So there are a lot of very positive effects that are known, especially in other let's say applications. For example, laser light is used in orthopedic fields since a lot of years, and it's very established in those kind of medical fields. But the using on the inner ear is absolutely unique, and the knowledge that we created around this technology and the application on the inner ear is absolutely unique. So all the patients who come to Sarasota, they get a really high knowledge of how to get their problems solved.
Mm-hmm.
What you see here is a slide about the results. The results have been documented by questionnaires that we gave our patients for several months and years. And of course, those fantastic results, what we need, of course, is that our patients work together with us. So if they use their hearing plugs, they protect their ears, they have the right nutrition, they have the right behavior, so they reduce stress, they reduce noise around them, and so on, then you can see that we can get improvements on dizziness more than 80%. We have improvement pressure on the ear, a phenomenon that is very often also combined with those inner ear diseases. We got more than 90% of improvements. The tinnitus, we are up to 79%. Hearing capacity, what is very important, we have an improvement of more than 80%, and also hearing distortion is more than 90%. So
you imagine if you had a drug that was this effective for anything, it would be blockbuster. You know, I mean, these results are unbelievable.
Yeah, so you don't need to spend thousands of dollars for hearing aids if you've got the possibility to improve your own biological structure. Okay, so let's have
Amazing.
a look on the next slide. What you can see here is, of course, there is a difference between patients who are treated in an acute period. So I'm speaking about an acute period between 3 and 6 months after the first impression of the symptoms. If we got the possibility to treat people in this period, in those first 3 to 6 months, the improvements are much faster, of course, than this is the first slide, the first.
Yeah, I would chime in there. It looks like we've got some connection issues, but you know, if you have recent hearing loss or tinnitus, if it's recent, get in right away. The sooner you can get in, the better. If it's chronic, we still can help, but it's not quite as quick, you know, for the results.
Of course, you see that if it's a chronic disease, we have several months to get them treated completely. But of course, if it's an acute process, it's very simple to get. Okay. This is again concerning the hearing aids. If you see the first chart, you see that the blue line is under the 30 dB. That's the critical line when you get a prescription for hearing aids. In the middle, we got an improvement of 10 decibel on 10 treatments. So you see with 10 treatments, you are up the line of 30 decibel. You don't need the hearing aids. So if you've got the first time the impression that you don't hear exactly, or you have to ask several times, send an email, send us your audiometry. Dr. John Lawrence will have a look at it and will give you a second opinion of what we can do. In the most cases, if you have a slight here, a light, do you say slight or light hearing problem? Light hearing problem?
Mild hearing.
Mild hearing loss. It's not necessary to have hearing aids, so you can avoid this completely.
Yeah, and that's why it's critical. At the end, we're going to give everybody an opportunity to have their audiometric performed or evaluated. And this is really important for us to look at this test to see where you're at, because it gives us an opportunity to really speak to what type of results you might expect with this treatment. And, you know, one thing also, a lot of patients that have tinnitus, they're like, you know, why I don't think I have any problem with my hearing. But what we're finding is almost all of them do, quite often significant problems, especially in those higher range of hearing. Yeah, so this is kind of talking about how regeneration is possible in other animals. You know, Dr. Kaiser.
This slide just shows us that there is a possibility also in the cases of animals that they can regenerate their inner ear cells. There it's absolutely normal. We have a lot of science about this. Concerning the regeneration processes of inner ears at humans, it's still there is still a black box. There is not a lot of scientific research about this. In the meantime, we can say that there have been done several studies about the effects of laser treatment on inner ears. So we go to the next. Okay.
Well, you know, I think the thing that people really need to realize with that is that there are other animals, reptiles and birds. Their hair cells regenerate. They never go deaf. So when you get that, you have to realize that there's just genetics, there's gene expressions that if they can activate those, that, you know, my belief is humans have the same opportunity if you give the right environment for that to happen. So 1 in 10 people in the United States suffer from tinnitus. So it's so out of 10 people that you know, one of them is going to be a tinnitus sufferer. It's surprising how many people have this affliction. It's a buzzing sensation. There are a number of different causes to that. People that are highest at risk are seniors, people that have worked in the military. I know Dr. Kaiser and I have worked with a lot of people that have been to war or, you know, shot a lot of rifles. Musicians, construction workers, you know, these are all common people that we see. I mean, it could be anything. If you work at a factory and there's a lot of machines around, you know, you're likely going to have a lot of damage to your inner ear. Up to 90% of people with tinnitus, as we said before, if your problem is tinnitus and you're watching this webinar and you're thinking, you know, I don't know if I need to do an audiometric, you do. Like, it's likely that there's some hearing damage. And what's beautiful about this treatment is that you may get your tinnitus handled, and at the same time, you might actually hear better. It's like, how nice is that? You're going to, you know, kill 2 birds with 1 stone, so to speak. We talked a little bit before about a lot of the treatments, especially for tinnitus. They actually are more harmful. You know, these are sounds trying to like cancel it out or fatigue out those hair cells so that they're not submitting that sound frequency anymore. You know, a lot of these things, they don't work really well to repair. They're just basically causing it to just go through its degenerative process quicker so that it fatigues out. This is a study. This is your slide, Dr. Kaiser. Do you want to?
Well, this just shows that there had been done a research about the laser.
Is that your dog?
Well, it's my dog. It's the time when I
sounds like
have a walk with them.
maybe she needs some laser.
Yeah. Okay. So okay.
I love it. Sounds like Lonnie. You know, sounds like my dog.
Well, it's that's the usual time when I go having a walk with them. You know, I got 2 of them. So get back to the slide. What you see here is that there had been done a research. There had been done a damage on inner ear cells by ototoxic antibiotics called gentamicin, and there had been done 2 groups. One group had been damaged, both groups had been damaged, and one group had been treated with a laser treatment. And they found out that the recovery of the inner ear cells was much faster and more stable with the treatment of lasers. So that's just to show that if there is a damage, it's possible to have an increasement of the quality. Okay, maybe you talk about this.
Well, I mean, I think the bottom line is that there's some studies that have been done showing that laser can help with tinnitus. We certainly have all these studies here in our clinic. If you want to reach out to us, we can always email them to you. You know, one thing to think about too is, like, I know this for some people sounds very futuristic and like, how could this really be true? Why doesn't my doctor know about this? Why haven't I heard about this? Well, think about back in 1940, you know, this Dr. Moore, Dr. Austin Moore, the first doctor to come up with a joint replacement. None of the insurance companies wanted to pay for it. Everybody thought he was a quack, that it wouldn't work. And now it's a standard of care. So, you know, that was 80 years ago. Where do you think we're going to be in 80 years from now? Do you still think that we're all going to be sitting around saying there's nothing that it can do for the inner ear? You know, I can tell you that, you know, just from my clinical experience, there absolutely is. And so this is just a glimpse into the future is what you're watching. You know, and I think both Dr. Kaiser and I see this as being the future of care. And this will be the future model that a lot of ENTs, a lot of holistic practitioners will utilize in their practice. This is what an audiometric looks like. These are what we do in our practice pre and post. So if you get this treatment done, you're going to get a beginning and a final. So we're going to actually see the results, and we see results on virtually all the cases that we do. In fact, this is an example of a patient that I treated. This patient had tinnitus and hearing loss. He was 62 years old, had it for 7 years. And you can just see the dramatic improvement on the right side. The follow-up testing was just dramatic. And you can see with this line here. This is another patient that had very significant hearing loss. And what we were able to do, and Dr. Kaiser pointed this out earlier, is that we were able to bring his hearing from a threshold where someone would be a candidate for a hearing aid to a patient and a threshold where he's no longer a candidate for hearing aids. And that's a beautiful thing. So with that said, I'm going to turn this back over to Dr. Pompa. And Kaiser, it was so happy to have you here. You're such a wealth of knowledge, and we'll talk really soon.
Thank you very much for the invitation. I'm going out with my dogs now.
Okay.
All right. Well, Alman and Dr. John, thank you so much. Look, I have to admit, I was one of the doctors telling people that with hearing loss, there's not much you can do. Then I came here. I myself had the audiometric, and I was surprised to see the hearing loss that I had. I had some viral issues, or some infection issues, I should say, that actually affected my hearing, as well as some traumas that affected it. I don't, maybe most of you watching this were me. My wife would be in the other room with some background noise, and I'm thinking she's just not talking loud enough. I really didn't know that I had a problem until I actually took the test. But at night, when it's very silent, I would hear this, expressing inflammation and damage. And it became unfortunately, my new normal. So, when Dr. John actually did the test on me, I was shocked, but it gave me hope. Here's the best part for me. I was able to do a retest and basically look and see what healed. And that's what really excited me about this technology. So look, normally it's $150 to get this done. And I also said you'll get your questions answered. So by clicking right on the link that you see to your right, you'll be able to get the audiometric, see where your hearing is, and you also get your questions answered. $20 instead of $150. And I thank you both for doing that. And I thank you for being here. When it helped me, this technology, hey, I made a commitment that I would help bring this to the United States, because I realize a lot of people are flying to Germany, although there are a lot of people flying to Germany, but it sure does make it easier to finally have a place here in the United States. Hey, it made it easier for me. So take advantage of the offer. And again, thank you, gentlemen. This is going to change a lot of lives. Click on the link now.